Hello, my name is Melissa Poulos. I am a hospitalist. I've been a physician for approximately 10 years. I graduated from medical school in 2007. 4 of those 10 years were spent in residency doing my training, and I've been practicing as a hospitalist at CAMC for approximately 6 years. I decided to go into the field of medicine because I'm passionate about caring for people. I'm intrigued by the human body, disease processes, and I'm driven by self-gratification, so I like problems that I can fix. So a hospitalist is a medical physician who is the team leader or the expert in providing care for patients that are in an inpatient setting. So if you need admitted to the hospital for stroke, heart attack, infection, we're really the experts in providing you with a plan of care to get you feeling better and to return home to your physician. And then we work with other physicians and other specialties that are on consult, for example, cardiologists, neurologists, to discuss what plan of care is best for the patient. And every patient is a little bit different. We work typically 12-hour shifts. So our day starts with reviewing approximately 18 to 20 patients that are in the hospital under our care. And we get started by dealing with acute patients or illnesses that need urgent attention first. So our rounds are spent kind of prioritizing who needs what when. And a typical day is rounding on patients, discussing the plan of care with the patient and their families, ordering tests, trying to figure out what the disease process is or what the treatment for the disease the patient's experiencing entails. And so it can be quick-paced, it can be Nancy Drew work, but overall at the end of the day I think it's very gratifying when you figure out what it is a patient's suffering from, get them better, get them the appropriate medical treatment and care, and get them home to their loved ones. So we work typically 7 days a week, so we work 7 12-hour shifts, and then typically hospitalists get a 5 to 7 day period off where they can engage in other gratifying aspects of medicine, teaching, research, other work outside of taking care of patients in the hospital. So some disease processes are exacerbated or brought on by people's daily living. For example, poor diet, alcohol consumption, smoking, obesity, oftentimes get patients into a disease process where it's a little bit late to fix things, and then patients sometimes aren't too receptive to the recommendations. So that can be challenging. In the inpatient setting, there are other challenges. The field of medicine, in specific hospitalist medicine, can be very pressured at times. We're forced to get a workup and a treatment plan in a more timely fashion. The thing I love most about being a hospitalist is that every day is different. And so I meet new people every day, and I experience new disease processes and new treatment modalities every day. And so there are no 2 days that are alike. Second, what I love most about being a hospitalist is typically I can get patients better. And so there's something we find that's wrong, whether it's a blood clot or an infection, and typically we can treat that and get people feeling back to their baseline to get back to what they love doing daily. I think that high school students have a vast amount of opportunity ahead of them, and I think it's important to dream and set goals. And so I encourage any high school student that may have a passion for people and for the human body to consider a field in medicine. There are so many opportunities. If being a physician is not one that intrigues them, I mean, physical therapy, occupational therapy, pharmacy are all great avenues to explore. I think being a physician is very gratifying, but it does require a tremendous amount of focus and keeping your eye on the goal. And so, we all have hardships that we face in life. academically and socially, but ultimately it's that desire to strive day by day and to keep your eye on your individual aspiration that will create success. So.